Here's a detailed explanation of the physiology of hypoxia, cyanosis, and dyspnea, including their mechanisms and interrelations. 1. Hypoxia. Definition: hypoxia is a condition where there is a deficiency in the amount of oxygen reaching the tissues. Types of hypoxia. 1. Hypoxic hypoxia, low arterial oxygen tension, PaO2, e.g. high altitude, respiratory diseases. 2. Anemic hypoxia, normal PaO2 but low oxygen carrying capacity, e.g. anemia, carbon monoxide poisoning. 3. Stagnant circulatory hypoxia, normal oxygen content but decreased blood flow, e.g. heart failure. 4. Histotoxic hypoxia, cells unable to utilize oxygen despite normal delivery, e.g. cyanide poisoning. Pathophysiology, reduced O2 availability or transport, aerobic metabolism, anaerobic metabolism, lactic acid, metabolic acidosis. Cellular energy, ATP, depletion leads to cell dysfunction and death if prolonged. Compensatory mechanisms, respiratory rate, hyperventilation, cardiac output, tachycardia, erythropoietin, RBC production, vasodilation in peripheral tissues. Cyanosis definition: bluish discoloration of the skin and mucous membranes due to increased levels of deoxygenated hemoglobin, 5-grammalia in the blood. Types of cyanosis. 1. Central cyanosis, seen in tongue, lips, due to systemic arterial desaturation, e.g. congenital heart disease, COPD. 2. Peripheral cyanosis, seen in fingers, toes, due to sluggish blood flow or vasoconstriction, e.g. cold exposure, shock. Higher physiology, hemoglobin must be at least partially unsaturated for cyanosis to appear. Cyanosis becomes visible when 1 5-gram deciliter of reduced hemoglobin is present in capillaries. More evident in polycythemia, higher HB, less evident in anemia, low HB despite hypoxia. Data 3. Dyspnea. Definition: subjective sensation of breathing discomfort or shortness of breath. Physiology and mechanisms: arises from mismatch between respiratory demand and capacity. Involves multiple sensory pathways, including chemoreceptors, detect CO2, O2, pH changes located in carotid bodies and medulla. Mechanoreceptors, in airways, lungs, chest wall sensing stretch and tension. Cortical centers, perception of respiratory effort. Causes: respiratory system issues, asthma, COPD, pneumonia, pulmonary embolism. Cardiac causes: CHF, arrhythmias, metabolic acidosis, respiratory drive. Psychological causes: anxiety, panic disorders. Pathway: 1. Oxygenation or CO2 chemoreceptor stimulation. 2. Respiratory muscle activity, respiratory drive. 3. Sensory feedback to brain, perception of air hunger or effort, dyspnea. Interrelationship among the three. Condition, associated effects. Hypoxia often leads to dyspnea and may cause cyanosis if severe cyanosis. Sign of significant hypoxemia, doesn't always correlate with severity of dyspnea. Dyspnea, common symptom of hypoxia and/or hypercapnia, even without visible cyanosis. Conclusion: hypoxia is a physiological state of oxygen deficiency. Cyanosis is a physical sign indicating hypoxemia. Dyspnea is a symptom reflecting the body's response to impaired gas exchange or increased respiratory demand. Together, these form a crucial triad in respiratory and cardiovascular pathology and require prompt evaluation and management. Here are 5 applications and implications of hypoxia, cyanosis, and dyspnea in nursing practice, focusing on clinical care, patient safety, and professional responsibilities. PA 1. Early recognition and assessment. Application: nurses must assess oxygenation status regularly using pulse oximetry S2, respiratory rate and pattern, skin and mucous membrane color, e.g. central cyanosis, patient-reported dyspnea using scales, Borg scale. Implication: prompt recognition of hypoxia and respiratory distress can prevent life-threatening complications such as respiratory failure or cardiac arrest. PA 2. Oxygen therapy management. Application: administering and titrating supplemental oxygen via nasal cannula, mask, or non-rebreather based on provider's orders and patient need. Implication: nurses must monitor oxygen saturation levels and watch for oxygen toxicity or CO2 retention, especially in COPD patients. 3. Patient positioning and airway management. Application: positioning patients in high Fowler's or semi-Fowler's position to ease breathing. encouraging coughing and deep breathing, using suctioning if necessary. Implication: prevents airway obstruction, improves lung expansion, and promotes better gas exchange, reducing the risk of hypoxia and subsequent complications. Monitoring and managing underlying causes. Application: identifying and addressing underlying conditions causing hypoxia or dyspnea, such as pneumonia, asthma, heart failure, or anemia. Implication: nurses must collaborate with the healthcare team to ensure proper diagnostic tests, e.g., ABG, chest x-ray are done, and treatments, e.g., bronchodilators, diuretics are administered. 5. Patient education and psychosocial support. Application: educating patients on breathing techniques, e.g., pursed lip breathing, oxygen equipment use at home, smoking cessation, and avoiding respiratory irritants. Implication: reduces anxiety associated with dyspnea, improves self-management, and enhances quality of life in chronic respiratory patients. Summary table, application, nursing implication, early recognition and assessment prevents respiratory emergencies. Oxygen therapy ensures safe and effective oxygen delivery. Proper positioning improves ventilation and comfort. Managing causes supports recovery and holistic care. Patient education promotes independence and reduces anxiety. Thank you. Have a nice day.